Another review that you promised during your confirmation hearing was the abortion access issue for VA. You said you'd
Yes.
look into that when you get here. Where are we at with that policy? Are you ready to announce a change? Are you looking at, I mean, and it's a very controversial issue, I know, for a lot of folks. Where does that stand?
We're real close, and that's about done. You'll be seeing that very shortly.
Okay.
Yeah.
You don't want to tell me the news now.
We got a couple things. Hey, look, I'm one of those that I want to make sure we got because the next thing you're gonna say, well, Leo, Doug, you didn't say that last time. So no, we're right there almost.
Any word on or any conversations with the White House yet on a permanent undersecretary for benefits, undersecretary for health? I know those are a little more complicated positions to fill, but they're key for a lot of the community care and healthcare expansion issues that you've talked about.
They're huge for community for those issues, but also I have just a little bit of a bone to pick with my friends up in the Senate. I need them to confirm Paul Lawrence as my deputy. As you may or may not know, and many people who watch this, until I get my deputy in, I have to do a commission for those two positions. I can't move forward on the commissions until he gets here. So I'm a lovingly push, hey, get me my deputy down here so I can get some of this stuff going. And then it just transitions on in further. So I'm looking at that and saying, how do we get that better equipped? But I'm sort of stuck right now until the Senate acts.
And then the last question for you, a lot of what's been focused on with VA has been so far the cuts, has been, the personnel that have lost, the contracts and everything else. I know you've talked about wanting to move forward on healthcare expansion, move forward on these benefits. When will we start seeing some of those, and what does that look like? What does that look like, especially with the healthcare side, where I know the administration has talked a lot about expanding community care, looking for ways to expand access. Are we going to get to see that soon, or is it just going to be more cuts first?
No, look, what we're seeing right now, and we went into a different topic, but I'm going to come back and tell what we have been doing. We've been busy here. We've been putting the focus back on. I mean, we've saved money, moving back to unity in our departments as far as DEI has been done away with. We've taken that money and put it back into our healthcare process. That's that was a lot of money, almost $14 million that could go back into it instead of uniting us, divide us. We've actually put out our flag policy, which said all veterans were united under one flag, and that is the American flag. The POW flag will be flown. And so we're reuniting and bringing us back together. We're taking issues that we have seen so far, as we've talked about already, the contracts and others, to get it back focused to where we need to be in this. So for me, behind the scenes, I'm working right now on about 6 or 7 projects all over this area to say, as we've sort of touched on here, are we organized properly in VHA? Is that something where we need to do? Why is our benefits seem to be at odds with our Board of Appeals? How can we make that more seamless? Why are we got a backlog in cases in which we could move forward? So those are all the areas that we're working toward, but I'm very proud of what our employees have done here. I'm very proud of what we've done across the system just in 4 weeks. And I'm gonna bring up one that you didn't ask. And it's been the bugaboo for the hill, so to speak, as you look at this concern all the time, is electronic health records. And it's been something that my predecessor decided at the end of December to say, we're gonna push that into 2026. It's been a $10 billion project that's not gone anywhere. I'm ready to tell you right now that I first had a meeting with our employees, then I had a meeting with Oracle, then I put them both together and we had a meeting, and it was one of those meetings where I forced them in my old counselor days to talk to each other, and then I put them in a room together for 2.5 days, and I'm pleased to announce right now we're moving forward on a new plan that is going to put online by next year almost double, almost triple the area where we're looking at of actually bringing hospitals and things online. We've worked through standardization. We've got some plans now that actually after 3 or almost 2.5 years of nothing, we're now moving forward to get this project done. So there's a lot going on here, Leo, that I'm excited about, and we're going to be announcing and rolling those out in the days to come.
Since you dropped that, I gotta just ask a follow-up here. So does that mean that you have confidence that the system can work, and that with things moving forward, you're going to be able to get all these folks online that quickly?
Well, they're going to have to face me every week that they don't get it done, because our folks understand that we got to do our part in a contract, and Oracle understands that they want to do the best job they can on their end of the contract. But I think the problem is we didn't have enough centrifugal leadership to say, let's bring you two together and actually do it. I've done that. As I said in my confirmation hearing, some of this is just leadership. Some of it is just what I have here is I walk around, I go see people, I talk to people. I'm not management by email. I'm management by talking to you. I'm management by hearing from folks. And leadership is about setting a vision, saying, this will get fixed. I'm not as concerned about the bits and pieces. Get it fixed. Last thing I'm gonna say, employee family here, and I've taken this on, and I say it's mine and my veterans. I take the two. I've encouraged our employees in the midst of everything. Go out and try. Don't be sheltered. Don't say, if you see something that can be better, let me know what it is. Let us know in the system. And if we fall down and it fails the first time, guess what? I'm going to be the one to pick you back up and say, I'm so proud of you. Now go fail again. Go do it again, because our veterans deserve better. Our government deserves better. The American people deserve better. And I'm tired of kicking the can down the road. We're not going to do that anymore.
Listen, Mr. Secretary, thanks so much for the time. Looking forward to doing it again soon, because there's still lots of issues for us to cover.
We all look forward to it. I trust you to always bring the questions.
Great. Thank you so much, sir.
Appreciate it. Thank you.